Hi, my name is Lara Pore, and I will be presenting on border foam usage to prevent pressure injuries in surgical patients. The objective of this presentation is to improve your ability and your knowledge to properly utilize border foam dressings, which patients are appropriate to use the border foam dressings on, and then also the appropriate placement of the border foam, and of course, follow up proper documentation. All of this to help prevent pressure injuries in surgical patients. At the end of this presentation, we'll take a quiz together and go over the learning and comprehension of the presented materials. Purpose of this education is to point out that nurses play a crucial role in preventing pressure injuries. And over 1 million patients in the United States annually have a pressure injury, and prevention indicates quality of care. Pressure injury prevention is also more likely to occur if the nurses don't understand the proper prevention tactics and the proper attention to detail as needed to apply the knowledge that they have in regards to pressure injury prevention. History of pressure injuries in surgical patients include that they have a significant impact on the overall health, often cause undue pain, prolonged and extended hospital stays, increased infection leading to increased use of antibiotics and other treatment methods that can cause harm, and possibly lead to death along with irreparable damage. Injury and pressure injuries can lead to a increased financial burden for the patient, for their family, as well as for the hospital and healthcare system as a whole. As I mentioned earlier, and it's important to reinforce that pressure injury prevention and pressure injury in hospital stays is a great indicator of the quality of healthcare provided, and can also in turn lead to those additional financial burdens and patient satisfaction. Risk factors for pressure injuries, particularly when we are talking about surgical patients, include profound immobility. So anesthesia causes the patient to not be able to move on their own. So whereas we might feel pressure or a little discomfort that would lead the patient to adjust their own positioning, their own weight, that ability is removed due to the anesthesia, also patient positioning and strapping down or use of immobilizing devices during surgery. Pressure injury can also be caused just by surgical trauma itself. So if there is surgical incisions and bandages and such that placed on these bony prominences, they may also end up with pressure injuries in those areas. Patient-related factors are very important to consider also. So comorbidities, we see often sicker patients, type 1, type 2 diabetes, hypertension, of course, obesity, and also in turn, an opposite of obesity would be lack of nutrition. So patients that are underweight also. Length of surgery is important to consider. Greater than 60 minutes puts them at a greater risk. It may not be necessary to provide the border foam dressings for surgical procedures that are going to take less than 60 minutes and lead to a quick discharge from the hospital itself. Kind of touched on this already, but the body positioning, often a prone position in surgery, but also Trump-Dellenberg or with anterior approaches off to the side, different areas, different positionings during surgery can cause pressure injury risks to different areas of the body. And also touched a little bit earlier on surgical equipment. So different straps, padding. The table itself lacks padding. A lot of times in the surgical suites, this is due to infection prevention. The national standards for HAPI, which is hospital-acquired pressure injury risk assessment and prevention, includes three major items: skin assessment, the use of the Braden scale for evaluation, and then HAPI prevention interventions. So here we're going to go over a little bit of information in regards to each of these three items, but also some documentation areas in Cerner where it's important that you get the documentation correct so that we can follow, and those nurses and providers that follow care after you have a clear picture of where they started. So skin assessment, it must be performed and documented on every patient admitted for surgery, whether they're staying as inpatient after surgery or if it's an outpatient going to be discharged the same day. Focused assessment should be based on the surgical plan and on patient's needs. This skin assessment on admission is crucial for identifying changes in skin condition post-surgery and, if needed, through extended stay. So here you see under the INO in Cerner, integumentary documentation, we have the area where it notes skin over bony prominence, and we're looking for any redness, blanchability, broken skin, those type of things. Next area for concern would be the Braden assessment. So this must be completed and documented for every patient admitted. Evaluate sensory perception, moisture, activity, mobility, nutrition, and risk of friction and shear. The score can assist in identifying patients' risk for pressure injury beyond the standard criteria. This is going to come in very important when we discuss the nursing judgment on when they can place the border foam dressing. So once again, in the INO, under adult system assessments, you would find the Braden assessment. You would need to complete that, and then following up with that is where you would document with HAPI intervention or prevention interventions. So here, the prevention that we're most focused on would be the application of the border foam dressing to the sacrum area while in pre-op phase of surgery, and then also focusing the other prevention intervention along with that border foam placement is going to be position changes while waiting for surgery. So again, in the INO, under HAPI prevention interventions, the most important thing that we're going to look at here is under the sensory activity, mobility, and intervention at the very top here, foam dressing to the sacrum. That's what we're focusing on today. Who? It's a good question. Who do we place these border foam pads on? So does every surgical patient require this foam pad placement? Not everybody does. So we're looking first at the length of surgery. So is this surgery going to be longer than 60 minutes? So let's say they're just coming in for an EGD. They may not be the most appropriate patient for this foam border dressing, but somebody that's going to have a much longer or robotic surgery, greater than 60 minutes is very important. The second criteria we're going to look at also is their age. So everybody aged 62 years old and older, they're going to be a prime candidate. So 62 years and older, even if it's less than 60 minutes, that might be okay too. But 60 minutes, 62 years and older. Also BMI. So anybody with a BMI greater than 40 or less than 17. That's where that Braden scale kind of comes into play on nutrition. If we've got somebody that's failure to thrive or has lost large amounts of weight due to cancer, border foam dressing is going to be very important here. And then the fourth thing is nursing clinical judgment. All you have to do is decide. I think this is going to be beneficial. You have every right to go ahead and put it on. There's no harm in putting it on somebody just because you feel like they probably need it. So very important. Nothing precludes you from putting it on if you decide it's necessary. So proper placement is very important. So this information is derived both from facility policy, but also from the manufacturer's recommendations. So first thing that we want to do is on the border foam dressing, you want to put the today's date. So whatever day it is that you're placing it, that's going to allow, if they have an inpatient stay, that's going to allow them to know when that was placed. That's deciding when they can replace it. Second thing is your initials. So if questions arise to the placement of that pad, they know what nurse to go back to. And then third, mark a P for prevention. In some of the units in the intensive care units, nurses are going to be placing those with an I for intervention. If there's already some deterioration noted, they would place it for intervention, but we're putting it for prevention, so a P for prevention. Step 2, assess the patient's anatomy and determine the appropriate positioning. So we're looking for the coccyx right here and the sacrum. So with the patient either standing up and leaning slightly forward or laying on the bed to their side, you're going to note where that bony prominence is and make sure that the bottom part of the border foam placement is covering that bony prominence. Second is there are 3 pieces of backing on the pad. You're going to remove the center one and release that film there. 4, holding the buttocks partially apart. You're going to fold the dressing in half, place the border foam dressing covering that sacrum, and then level out or place that sticky part to the patient's backside and remove any air bubbles and make sure that it's secure. Step 5 is remove one side, gently smooth that side into place without any wrinkles or air bubbles, and then remove the other side and do the same thing. I would like to stop, pause, and take note. It is very nice and expected as a nurse that you verbalize these actions to the patient for their own just their own well-being, to make sure they understand what you're doing. Ask permission before you touch them. It's kind of a private area, and explain to them what you're doing. Often also, these pads are very cold, so give the patient a warning that what you're going to be placing on them is cold. And those are just 2 nice things to do, good patient care. Step 6, press and smooth the dressing, once again to ensure that the whole dressing is in contact with the skin without any loose areas around the edge. So we don't want anything like fluids or incontinence or anything getting under that dressing. Kind of goes against what we're trying to do here. So on an outpatient basis or an inpatient that's ready to go home, before discharge, you're going to need to remove the dressing. So when you remove it, pay special care to patient's skin and make sure that you're not pulling, tugging, ripping, or causing any further damage. You'll need to do another skin assessment to ensure the current state of the patient's skin underneath the border foam. Document that skin assessment and detail any changes in skin integrity. This is a good point too, that when you remove that, if you notice there are large changes or any questions, go back to the previous documentation and ensure any changes that might have occurred and notify the physician or the attending physician as necessary. We have reached the end of the presentation, and I'd like to go over just a bit of knowledge assessment as a group. What are the 6 risk factors? What are the main risk factors for pressure injuries in surgical patients? A, profound immobility. B, surgical trauma. C, patient-related factors. D, length of surgery. E, body positioning. And F, surgical equipment. This is a simple one, all of the above. All of the above are risk factors that need to be considered when we are deciding on the proper utilization of the border foam dressing. Second question, what are the standards of pressure injury prevention? And we've talked about this. First is skin assessment. Second, Braden scale. Third, happy prevention interventions. So all of the above are the standards of PI prevention. And who should the nurse place the border foam dressing on? We just went over this also. So consider surgeries greater than 60 minutes, age 62 years and older, BMIs greater than 40 or less than 17, and most importantly, and we miss this sometimes, per nursing judgment. Use your degree, use your knowledge, use that gut feeling, and utilize the foam dressing where you find necessary. What information should you write on the border foam dressing before placing it on the patient? We went over this: date, nurse's initials, and a P for prevention. Thank you for attending the presentation and education. Please reach out with any questions. I appreciate your time. And located also are the references to utilize during this report. Thank you and have a great day.